I found it this morning, in the shower. I wasn't even looking.
I was just, showering.
And I felt something.
Small, real, there.
I wish I could ignore it.
I wish it could go back to before that tiny lump became the biggest thing in my entire world.
Instead, I'll go to the doctor because I want to know what I'm going to do next.
And how I'm going to make my life normal again.
I just want to know that things are going to be okay.
What would you do to make sure the women in your life have every available resource in the fight against breast cancer? Mercy Health Partners has launched Be Here, a campaign for breast wellness. Be Here will help bring a comprehensive breast center to the Lakes Village, providing women with the most innovative breast care available. The center will completely change the way care is delivered to the women in our lives and on the lakeshore.
The American Cancer Society literature, all the literature will share that breast cancer is 99% curable when caught in the earliest stages. And that's just an amazing statistic.
I think that anything we can do to make this stressful situation better, we need to do it.
Only 60% of women are getting their mammograms, and so we do want to provide an environment where women feel comfortable coming in and getting their mammograms, and because if we improve compliance, we can improve early detection.
This comprehensive breast cancer center could be a warm and inviting place that women will be less intimidated, and they will take care of their health, which in the long run can prevent some of the health issues that we deal with today.
Had the mammogram, was trying to fit it in my schedule of traveling, had no thought that it would be any different from the other 30.
I had had a mammogram 6 months prior that showed a spot that they needle tested, and it was benign. And then 6 months later, I had a mammogram and they showed the spot, and then they went in, and of course it was the cancerous.
And he had checked the lab work because he knew I would be concerned over the weekend. And he said, worry, you have cancer.
I ended up calling my primary care doctor and asking her if she could try to steer the ship, because I was just not sure what appointment I was to get in what order.
And it can be very confusing to a patient in a time where they're extremely anxious and concerned about this new diagnosis. And so the nurse navigator will help them coordinate the care.
The nurse navigator is there to assist our patients all the way through the process, beginning initially at their diagnosis, through their treatment, and ultimately into survivorship.
This is a way that we can lessen the anxiety of a situation that is no fun.
Everything that the patient would need in terms of the supportive care is part of their treatment.
We have excellent physicians and surgeons right here in town, so to be able to offer this high quality service right here in their hometown gives them comfort and exposes them to excellent care.
Gives patients comfort that they're going to a nationally accredited center where all their quality measures are being measured on a national level.
In certain cases, we're able to activate our rapid results program and provide women who have a abnormality on a mammogram or ultrasound a diagnosis within 24 hours. So many women would appreciate that and have told us that they're very excited that this service is coming to the community.
Our biggest thing is we want more and more people to be able to brag, if you will, that they're a cancer survivor.
It's going to make that life easier for anyone who unfortunately gets that diagnosis.
Come in here, you'll be well taken care of, and you don't have to worry. We've got you.
What would you give to make sure that the women in your life have every available resource in the fight against breast cancer?